Game time. Game time. We're gonna kill it.
You ready?
I was born ready.
All right, homie. Let's do this. Hello, my name is Dustin Gone. This is the Alternative High Podcast, the #1 podcast in Southwestern Ontario. That is a fact. Today is an extra special podcast. Today, I've come to Hamilton to meet a man that has been a driving force. We're moving towards the Sick Kids Hospital project. However, today, the driving force for this is young David. And David has a story that will bring you to tears, that will make you smile, that will give you inspiration to work harder, be smarter. And there's gonna be some stuff that's kind of hard to hear. I want you to hit the points that people just don't understand, because may it be skin color, may it be living conditions, wherever people are zoned, geographically speaking. Today, so I'm gonna give a quick little rundown of why so the Prince Hall family had a commitment to Sick Kids Hospital for a amount of money that we wanted to raise to bring research to sickle cell. And the idea was, how do we do that? And I got to thinking about what it was we could do. And without making this about a me thing, I would like you to maybe explain sickle cell on a way that people could understand it in the simplest form, and we'll navigate through that. David, Can you explain that for me?
Yeah, so basically, Dustin, thank you very much for having me. First of all, I appreciate you so much. It means the world to me, just being, in your presence and being able to do this podcast with you.
Dude,
I am
we were brought together
excited
for
is
a
an
reason.
understatement, man.
We were brought together for a
especially,
reason.
I just got discharged from the hospital yesterday, right?
Yeah.
As you know, early last night. So I'm like, nah, I gotta do this podcast. So this is mad important. But basically, what sickle cell is a blood disease, right? Where our red blood cells, you know how we have our blood and we have like our cells and stuff. So usually our red blood cells are like in a circular shape, right? It's a circle. Now us people born with sickle cell, our red blood cells are sickled. So sickled is like a banana shape, or like a moon, a crescent moon.
Crescent, yeah.
You know what I mean? So what happens is, you know how your blood flows through the stream perfectly. Now, when it's circular, it runs through smoothly, in its movement and everything. But now, having sickle cell with the blood cells being crescent, what happens is it causes a traffic jam. It interlocks with each other. Now, when it interlocks with each other, wherever that area happens, that's what we have, like wherever the blood clot happens, that's what we call a crisis. And what a crisis is a pain crisis. So wherever that happens, you're gonna feel so much pain. You can't breathe, you're crying.
Do you have like an average monthly, and I don't mean to cut you off, of crisis? Like, do you hit them no matter what, every month, every couple months, weekly?
Now, for everybody, it's different.
Okay.
It's different. Some people have it once a year. Some people have it once every 5 years. Some people have it even once every 10 years. You know what I mean? It just so happened that me and my case is so severe, that I average being in a hospital every month. Every month, like clearly, I think 2024, every single month I've been in the hospital. And my admission stay, it doesn't even make sense. My average stay is 3 weeks. a month.
While you're in there, you're not being chill. You're in there, you're making beats, you're still trying to, like, I design, P.S., we're in your store. Do you want to explain the store?
Yeah, so this is our clothing store. This is our home. It's called N'Arrête Jamais. That it was founded by me and my partner, Sai.
What does it mean?
N'Arrête Jamais means never gonna stop.
And I would say that's a pretty good statement for you, because you don't stop. You're here. Design, is it goes towards your foundation?
Pardon?
Does the clothing line?
It's different. It's two different entities.
Yep.
But it's all intertwined.
So what
It's
I
like
was
one
going to
body.
get to was that some of your money goes towards
Yeah,
helping
100%.
Sickle Cell Foundation.
Yeah.
And
100%.
what's your goal with that foundation?
With the Sickle Cell Foundation, first of all, the biggest thing that we're trying to do is directly help people with sickle cell, like the patient themselves and the caretakers.
Yeah.
Right? So what we're trying to do is basically help them out in their moment of distress. Because unfortunately in the health system, there is so much racism, there's so much hate. It is so insane, and we find ourselves where we don't know who to call. We don't know.
Well, Sickle Cell is not a funded, government funded.
No.
And it's not a registered
No.
blood disease.
No.
Which is wildly.
Especially January 2024 and about to be 2025 is insane.
What happens whenever whenever somebody with sickle cell is put in a situation where they've gone into the hospital and they need their help? What happens to some people? Like, I know you have a story that's kind of near and dear to you. I don't know if that's something you're willing to share, because it's an awful situation.
Yeah.
Try not to cry here, but like, explain how bad sickle cell has been misrepresented and what has happened.
So what happened to me was insane. It's a story that it lives for me forever. There's not a day that I wake up not thinking about it. You know what I mean? And it's about my older brother. His name was Kilazar Manyoyo Mangala. That's his name. And basically it was summer of 2016, I'm pretty sure. 2016 or 20, I think it was 2015.
Okay.
Summer. And we're at home, summertime, right? So we're having fun, we're playing basketball. We're there, we're all my friends, jamming out like any other kids. And at that time, I was
9 years ago, so
I was young. You know what I mean?
8 years old.
Yeah, I was
Or
young.
17.
Yes, around there. So basically, what happened was my brother was having a pain crisis. He was having a pain crisis. So I'll never forget, his back and chest and both of his legs was hurting. You know? And to give you a picture of it, imagine a young man laying down, bawling his eyes out, yelling, begging for the Lord to make it stop. Sweating, tears coming down from his eyes at Niagara Falls, crying so much that we have snot coming down our nose. We're drooling. It's bad. It's a traumatic experience to even just watch it alone. So he was having a crisis. He's yelling. And then I'm like, oh my gosh, what to do? So first, I gave him his pain meds and stuff, right? Because usually the pain meds that we get opioids. So I gave him his 4 milligrams of his hydromorphone. I'm pretty sure. I think that's what his dose was at that time. It wasn't working, so we had to wait a little bit, gave it to him again. Wasn't working, so then in those type of situations, you have to go to the hospital. So now, since he was in so much pain, I just ran upstairs and I said, Ma, is it okay if I can please use your car? I gotta drop Guy. Guy's having a crisis right now and it's bad. And of course she knew, right? Because she was the one like helped me. She's like, okay, take him to the hospital and I can drive. So basically, I had to grab him and carry him. Literally, I carried him all the way to the car, opened the shotgun door, boom, placed him on the seat, and I put the chair all the way back, close the door, hop in the car. As I hop in the car, I skirt off, and I'm going toward direction to a hospital. It's called St. Joseph's Hospital, right, in Hamilton. So I'm driving that direction. My heart is beating, and I don't care. I'm running these red lights, like, I don't care. I mean, if we're having a police chase, they're catching me at the hospital. My mind was made up, like, I did not care, especially how intense that was.
Mm-hmm.
And so I'm driving, and mind you, I'm driving, and at the same time, I'm like rubbing him in the back. You know, I'm rubbing his back because he's like in a lot of pain. So I'm just trying to massage wherever he's having the pain. And I'm driving at the same time, and as I'm driving, I'm going to the direction of St. Joe's. As I'm driving, and he goes, "Don't go there, don't go there." What do you mean, no? What do you mean, don't go there? And me at the time, I was younger, so I was going to McMaster's Children's Hospital. So McMaster's is La La Land. It's basically heaven for us. You know what I mean? So as I'm driving him to the hospital, because he couldn't go to the Children's Hospital no more because he became an adult, right? So I didn't understand that because that didn't make sense to me of how I'm driving to the hospital and say, no, don't go to that hospital. So I'm like, okay, so what do you want me to do? He said, go to another hospital. So I'm like, oh, okay, no problem. So he's busting me, and I take him to another hospital. The hospital was named Dravinsky. It's in Hamilton Mountain. So I drive. And then there was a lot of constructions at that time. Like, you can't even get through. So there's like a big B there across from the street. So I said, I said, wait in the car, park in the big B. I ran, like when I tell you I ran. Running the ER. I said, I need help. I was having a crisis. I need a wheelchair. They give me a wheelchair. I got the wheelchair. I run straight to the car because I knew that I wasn't going to be able to carry him all the way to the ER, right? So I run. I come to the wheelchair, grab him, put him on the wheelchair, close the door. Run to the ER, boom. As I'm running in the ER, I said, I'm some crisis. The fact that, like, the case was so, I mean, it's like, it was so dramatic, thank God at that time, they took him right away. And they took him, like, right away, boom. They took him to the back room and stuff like that. And now he's bawling his eyes out, he's crying. I'm like, damn. And then as he's crying, I'm just there for him. I'm like, nah, don't worry, you're gonna be like, you're gonna be all right. Don't worry, they're gonna give you a pain mask, you're gonna be okay. And then they gave him his oxygen mask. He had his oxygen mask, and then he was accessed, and he was getting his hydromorphone and stuff like off his like drip off the IV, you know. So that's a very strong medicine. So that was making him like very, very, very sleepy and stuff, right? And since it happened on the afternoon, my mom had to go to work, and my mom needed the car. So I told my brother I stay with them, and I told him, okay, you know what? I'm about to leave because mom needs to go to work, right? So if you need anything, just text me. I got you, and I'm gonna be back. I'm gonna come back tomorrow, right? So I head back home. I get my car. Boom, no problem. Now life goes on. We're texting back and forth. Everything is good. A few FaceTime calls. We're laughing. Everything is good. After that, boom, no problem. Everything is okay. Next thing you know, I used to get tired very, very, very early, of course, because I'm sickle, so I get weak. So I'm like, around like, I think it was like 9 or 10. 9, 10 p.m. I was very tired, so I'm like, I'm gonna go to bed. So I actually went to bed early that night. I went to bed, whatever. I slept. So what basically happened, 11 p.m., he was having a lot of pain in the hospital. He called his nurse for his pain meds. We call it a bolus. That's what we call it, a bolus of pain meds. First he's calling the nurse. Nurse is not coming. Okay, 1.5 minutes. Calls again. She's still gonna show up. Time went by 30 minutes. He's like, what's going on? Yes, he's teary-eyed, he's crying, he's like, a lot of pain. You know, he's like in mad pain. Calls again. Nothing. 45 minutes go by. After an hour, he said, you know what? Since I'm in so much pain, I'm just gonna walk to the front desk and I asked my nurse for my pain meds because his chest was hurting. Right? So then he goes and he has his IV pole and everything access, hops out of his bed, holding on that pole for dear life. He's walking down as he's crying and he's walking towards the front desk to ask for some help. He's walking. And as he's literally about to arrive there and ask them, excuse me, is it okay if I can please have my pain meds because I'm in a lot of pain? As he walks in, he's about to talk, and he drops. When he drops on the floor, now, oh my gosh, he just dropped, what's going on? So the nurse runs, feels his pulse or whatever, code blue. Now what code blue is, in a hospital, it means that someone's dying and you need all hands on deck, right? And they call code blue, they try to save him, boom, they do their thing. And then it turned out that he needed surgery. So at like midnight or like 12:30, they had to send him in a code blue straight all the way to surgery, to the OR. Goes to the OR. Mom and family gets a call. I don't know. I'm asleep. Like, okay, no problem. They start praying and stuff like that. I'm asleep. 5 a.m. hits. I hear, when I tell you I jumped out of my bed, kicked my door, and I heard it from my mom's room, right? So since I heard it from my mom's room, I thought something was going on, so I just hop on my bed, I kicked through my mom's front, I kicked my mom's door down, like basically, boom, Mom, what's going on? She goes, nothing. What? Hell nah, ain't no way nothing's going on. There's no way nothing. I mean, your boy, you tell me nothing. She's like, oh, nothing. But the way she was crying, I knew something was up very bad. Now at that time, my grandfather had cancer. And it was very, very, very bad. So I thought that it was my grandfather. So I said, Mom, is it Grandpa? Is Grandpa gone? And she said, no, Grandpa's okay. So I'm like, Grandpa's okay. Huh? Okay. So I'm like, Mom, what's going on? She does not want to tell me. She's like playing, basically, like as if she's in an interrogation room and she ain't snitching. She said, nah, she's a top G, she ain't saying nothing, you know? I'm like, Mom, what's going on? Then I hear my mom's phone. She's like, it keeps blowing up. So I'm like, Mom, you gotta tell me what's going on. And at the same time, my auntie walked right into my door. Mind you, it's 5 a.m. Walked into my door and I hear her yell. Boom, she drops on the floor. I hear, then I'm with my mom. My mom, she's on the bed. Boom, falls on. I'm like, okay, no, what is going on? And then she grabs a little bit of courage. And she goes, Dave, I gotta tell you something. I'm like, what? I'm like, what is it? She goes, he's dead. I said, Mom, you lying. You lying. No way. Mom, I dropped him off. It was me. I seen him. What do you mean? I dropped him off. Right before I dropped him off, I love you, on my heart. Okay, love you, baby. I love you, little bro. Boom, give me a kiss. Right, you the best, you little brother. I wish I man, shut up, but no, I love you. You know what I mean? So, I mean, there's no way past it. Like, no. You know what I mean? And then my phone starts blowing up. And as my phone is just blowing up, it just doesn't make sense. I'm calling them. I'm texting them. And then that's how I learned that my brother passed. Sickle cell crisis, you know. So that's how real it is, man.
And like, that's something really at your age, at anybody's age, it's, especially when you're dealing with the exact same disease.
Yeah.
Going through that in that moment, can't even imagine what you're obviously lost.
Yeah.
And then, what kind of, with that, how did you feel afterwards trying to explain yourself when you would go in? Because now you're at that age where you said that the children's hospital is no longer accessible to you. So how was that knowing, how was that navigating that?
That whole situation was actually so crazy that they sheltered me. They actually had to go to the government and they extended my stay legally. So they had to go to court. They went to court. And I stayed in the children's hospital until I was like about 21 because they wanted to make sure that the bridge was conducted well. So I had like touring date where I had to go to the ER and just go and see how it goes. And shouts out to my doctor, Dr. V, Dr. Verhofstadt. She really did her best and she did everything that she could in her power to make it as smooth, to make it perfect, to explain them everything, to explain them what everything I went through and stuff, you know what I mean, so they could get it. And at the beginning, I was like, oh, okay, no problem. But then when I was having my first crisis.
As an adult?
Yeah, like, so when I actually,
bridge thing.
Yeah,
Yep.
After the bridge thing was done,
Yep.
and now, okay, now that's where I gotta go. And I went. That's when I started facing the stuff that he was facing that I never understood.
What is that you're facing?
Okay. Imagine being in a sickle cell crisis. As I showed you how intense that even looks like.
Mm-hmm.
Right? And imagine there's nurses and doctors. Doctors that went to school, med school. You go there, you do the triage, they open your file, they see, it says on the computer, David, sickle cell disease, blah, 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 blah. My whole file is there. You can literally read it. You know? And for some strange way, they refuse to give you medication. Because for some reason they say, no, we can't give you no medication. Why? I don't know, because I'm drug seeking. We're drug seekers. But we have a real life disease. And even though we're crying or
And
whatever.
it's clearly in your whole file from, you've had this since birth.
I was born with
It wasn't actually acknowledged till you were 5 months old. 7 months old.
That's when they figured out I have sickle cell.
You had that, and I don't want to breeze by what we're talking about right now because that deserves a lot more attention and that needs to change. And I promise you, we will do whatever we can do in our powers, so whatever for the next however long it takes us to finish this project. But have you had that conversation with your mom? What it was like for her having the conversations about a baby that she can't explain why it's screaming, crying?
Yeah.
Where
I did.
how how was she treated? Is it just, are you just, you know, have that mom thought, new mom, kind of maybe you're postpartum, like, or were they trying to tell her that it might be in her head, or were they like, oh no, this is, your child could be dealing with this?
When I spoke to my mom, right, I was 7 months, right? And then that's when I had my first crisis. Now, since she was so lost, she did not know what was going on. Because I was a baby that I just loved to eat. I loved eating. So she would do everything. She's giving me food, I'm spitting it out like I'm. She's like, what is going on? Okay, maybe he wants to sleep. Nothing. Okay, you know what? Maybe let me try and change his diaper. Nothing. She's just trying all of the above. And imagine a baby being 7 months and wailing. She said that.
Yeah, there's
one thing
no
that she
way to
told
tell
me.
what's up.
One thing she told me that I won't forget. She said, David, the way you cry when you're in crisis is so different. I've never heard a cry like that in my life. So that's how she could tell the difference, because of the way I was crying, the way my body was
Mother's
reacting.
intuition is real.
And the crazy part is this: when you're a baby and you watch a sickle cell baby have a sickle cell crisis, you get, depending on the baby's skin color, you can see where it's happening, depending on how it is. But it would look like very, very, very red, even like purple, like violet, wherever the area is, because your bones are not, it's not defined, it's not made strong enough. You know what I mean? But me, I didn't have that. I know there's like that. I seen those images of other babies, but I wasn't that type of baby where you can physically see it. And so she was just trying every single thing in the book. You know what I mean? Everything. And it wasn't working. And my father was trying to do everything. Nothing worked. So when she did that, she's like, yo, this is not normal. They did like almost 24 hours. Right? And right after 24-hour mark, they're like, nah, we just gotta go to the hospital because this doesn't even make sense anymore. Because they didn't even know. Mind you, my mom, growing up, she doesn't even have a cousin that had sickle cell. She didn't even know people that have sickle cell. Same thing with my father. Even though like him and my father's family, like I have a lot of like family members that have sickle cell, but he never experienced it firsthand. Like he heard about it and stuff, but like he never lived it, right? So it was something that was brand new to both of them. You know what I mean? And then when they took me to the hospital, and then we did the blood test and everything, that's when they said, yup, your son has a disease, he has sickle cell, SS, which is the worst type. Yeah.
It's a lot. What are in your eyes, how would you like to see things moving forward go? How would it make what you've gone through, like telling your story, being open about it, the vulnerability, because everything's going to be small change, everything's going to go in a little bit. What would be the first steps to bringing more eyes, some finance, what does that first step look like, do you think, in helping people in the start of sickle cell, like young age, to growing up with it, to adulthood? What does that first step look like to you? Do you have an idea?
Yeah, I feel like the number one thing should be first recognizing that there's an issue.
So, like getting it registered by the Canadian government?
That's the number one thing.
Okay.
Because just like this, you can't treat something you don't know.
Okay.
You know what I mean? So that's literally the first step. You gotta diagnose it. You know what I mean? So you gotta, first of all, recognize, okay, there's an issue right now. Sickle cell. That's a big issue, especially in Canada, because there's a lot of us. There's an army of us, hundreds of thousands. You know what I mean? Like, and worldwide, globally, millions.
Yeah.
You know what I mean? So I'd say in Canada, number one, recognizing that there's an issue. They need to sit back and actually go, no, there's an issue. There's people suffering with sickle cell disease. We need to treat it, and they're getting treated unfairly. That's the number one thing.
Hitting some hospitals, seeing what they know about it.
And that's the first thing.
That's part of our project
Yeah.
in 2025.
Yeah.
You want to talk about that a little bit?
Yeah, that's the number one thing right now. So that's why right now the first thing that we're trying to because when we were in the children's healthcare system, things were so smooth. Of course, not perfect, but it's as close as perfect can be. If you know what I mean. We never had none of these issues. You know, me, I had even a VIP card when I got to McMaster, right? As soon as I step in the ER, David's here, okay, boom. They get a back room ready, and then they get me in right away because they understand that time is of the essence, you know?
Do they carry something around similar to a VIP card, like when you have to make master as adults? Do they have any sort of, you know, like when I had penicillin, I wore a bracelet, and it was, you walked in and you're allergic to penicillin. So nothing for, so there's something there that we should try
Zero.
Try and figure out.
Come in, yell in, you can do whatever you want.
That's an interesting thing.
Yeah, it's literally,
Yeah.
sit down, wait when we're gonna call you, and and matter of fact, when it comes to this lineup of about, let's just say 50 people, you're the 51st. Yeah, so.
You're just supposed to be alright with that.
And then you gotta remember, there's people there that have paper cuts. You know what I mean? There's people there maybe that broke their arm. There's maybe someone
it's
there
very
that
difficult
cancer.
to,
You know what I mean? So, like, the thing, at least what I would personally think, at least if I have a hospital or something, I would think that if someone got shot, they would get served first. You get what I'm saying?
go by what you think is
more urgent.
Yeah.
That's why it's the emergency care room. Is it not?
Makes sense.
You know what I mean? So it's the person that's going through
The highest crisis.
Yeah, exactly, the highest crisis.
I can understand that. Well, so 2025 in partnerships, we're going to work on a project together. We're going to try and bring some attention. Next September, we are going to do cycling for sickle cell.
Yeah, bike ride.
We're going to bike Windsor to Toronto.
That's
I'm going to
crazy.
hit every single hospital, and depending on how you're feeling, what you're doing, I want you to hit the hospitals with me.
Yeah, don't worry, I'm gonna be there.
Yeah,
I'm gonna be
you're
there.
the.
God willing, I'm not admitted. I'm gonna be there.
You are the driving force. You are my inspiration on this.
I appreciate you.
We run parallels. Sickle cell and a spinal cord are not the same. The only thing that I can understand is pain.
Yeah.
And the type of pain I have, who's ever to know? And it does not matter.
Yeah.
It is just something that sucks. And I'm wanting to change I'm wanting to help, because this is disgusting. The way you've been treated, the way that things have went down. We won't go down that negative road. I want to end this on a positive note, and that being the project that we will do is going to be towards the first research facility at the Sick Kids Hospital. And then we'll work on getting this registered. And then we'll work on getting this funded. I don't know what this will take of us, but I ain't shutting it down until we've got those 3 things done. And that's just how that story is going to go. So hopefully we can settle everything in 2025, but if we have to take it into the following years, we can do that.
So one thing that we're working on, I feel like something that would help sickle cell patients a lot, is to have a medical daycare. So that's one thing that the David and UC Sickle Cell Foundation, which is basically the foundation of me and my family and my beloved sickle cell people who are firsthand suffering with sickle cell, and where we want to create or have spaces where, let's just say if the ER was full, because they had stuff like that in children's healthcare when I was at McMaster, where you don't necessarily have to go to the ER. Sometimes if you call the clinic, right, they'll reserve a bed and they'll have all your medicine and everything ready, and you just go straight to the clinic, you get help, stay there probably for a few hours, and then you go home, and that saves a lot of time. It saves even admission, because it's not every time that we come to the ER that means that we're going to get admitted. Not every time. You know what I mean? So that's one thing that I really want to build inside almost every hospital, let's say in Canada. Of course, I'm going to start where I'm at. So I'm going to start by doing that in Hamilton, like probably at St. Joe's or something, where, because I know that's where the hemoglobin stuff are. So I would like to build a fund where we can have a medical daycare at St. Joe's, so sickle cell patients could go straight there, and then we could do that and basically expand. Because you see what's happening in Sickle for the research lab and let's say the medical daycare and stuff. That is amazing. And we're so happy stuff like that is getting done, but that's still a drop in the ocean.
100%.
You know, that's a drop in the ocean, and one thing we're trying to do, we're trying to expand.
Once that drop in the ocean has been set, the only thing that we can hope and pray is that drop turns into a waterfall. And it just, I don't have any idea. I've not lived a life like that. It's been much different for me. But I can stand beside you and do my very best. And I am honored to have met you. We've been talking for a while now. I've been wanting to get down and just meet you. This podcast is cool, but nowhere near as cool as getting to be in your presence. You just, with everything going on, you're just, every time I talk to you, how you doing, Dave? You could be laying in a hospital bed. I'm blessed, Dustin. I'm doing, dude, you are so positive. You're so sweet, kind. You bring greatness to my life. It's been a blessing meeting you. We got a lifetime of stuff that we're gonna build, but like in the next year, let's work on this sickle cell project. Let's make it as magical as we possibly can.
And I feel likewise, by the way, Dustin. I appreciate you so much. Being in your presence means the most to me, and to have you as a partner with us, you don't understand how much that means to us, you know, so thank you so much. Biking all the way from Windsor to Toronto is insane, and you're doing it for sickle cell. You know what I mean? So, I appreciate you, Dustin. Thank you.
Love you too.
God bless you.